Unmuted.
Uh-huh.
Guys, can you hear us?
Yes.
Yes.
Oh,
okay.
super.
Yes, we can.
Okay, great. Great.
So we start, or
maybe we can wait for another 2 minutes? No, it's actually 2. We can start, and then if people join us later, they can, or they can. What do you think, Marichka?
I can see I may start. I just see that there is stronger together, but I cannot understand if they are in or not.
I think they are in, but without the
video.
Looks like they are in, but without the video. So then maybe we can start, and then people will join
Okay.
us. That's fine.
So, dear colleagues, hello. My name is Maria. I will lead the webinar today for you. So our webinar will be, will have 4 blocks. First block, it will be difference between different components of M&E system. Second block will be dedicated to the indicators and how to form and prepare good indicators for your M&E framework. And third part will be dedicated especially to advocacy of M&E of advocacy projects. We will discuss small examples, and if you have any questions or your own examples, we still may discuss them. And the fourth block, it's small, it's actually for your own use. I did prepare for you a few templates, and I will show them, and you will be able to download them or use for your future projects.
So add here that we will prepare an online resource, whether it's a Dropbox or something else. We will decide on the format, and we'll share with you later. Okay, I will inform you on that. And also, please note that the webinar is being recorded, and that it will also be available online.
Okay.
Okay.
Yeah. So since we have 4 blocks, I propose to have small questions and answer session after each block. Unless you have some critical question during the presentation, please raise your hand. I'll see you on the video, and I'll stop for a bit, and we'll discuss your questions. If that's okay, we may start. Yeah.
Yeah. Okay.
Okay. If I will go talk too fast or something like that, please also somehow give me some signal, and I'll slow down a bit. Okay. So let's talk about the difference between monitoring and evaluation, and how we what is this, and what we have, and what should we use in our projects. So basically, if you talk, there is two big concepts of monitoring and evaluation. Monitoring, of course, it's routine tracking of key elements of your program or project performance. Usually it talks about inputs and outputs indicators, and a few slides later we will talk about that. So basically, if you use why should we use monitoring? To manage our program, to improve it, and to be accountable, which is very important nowadays. I will ask probably some of you to shut down your microphones. Oh, I may do it by myself. Okay. Yes. Okay. Thank you. By using monitoring system, we may manage and improve and actually account our resources. By resources, I mean everything what we may put into the program, which is staff time, equipment, funds, everything what you have in your organization, that's your resources. Then activities, that's what is actually planned in your work plan. I'm sorry, small. Then we monitor results. This is what is your intention in your project or program or activities. What will happen as a result of your activities or your work. And quality of data that you collect, quality of service that you deliver. Just to check yourself, if you form your monitoring system, you may ask yourself a few very simple but very important questions, such as, are your activities being carried out as planned? So what is planned in your work plan is carried out in timely manner and with the resources that you plan. What is the organization providing what to whom, to which beneficiaries, where you providing your services, for how long time, in what context. Then you may ask yourself, what activities are accessible? Is the qualities of your services that you are providing adequate? Is the population you want to intend to engage have been reached? So is all this parts of your monitoring system are in place? Then I would propose you a small exercise that you may also done on daily or routine basis for yourself. When you create a new project, when you're thinking about monitoring and evaluation system to your project, you may start with trying to describe your program. So what you want to achieve, what is goal of your program. Decide what you need and how you will use it. And then you decide which data you want to collect to prove that you did any activities, and how you want to collect this data, and then how you will interpret and use it. Later on, we will talk about this later. Then you collect your data that you have in mind. You manage and analyze this data to understand what you did and if there is any progress in your activities. And as a final step, it's a report of the information that you use. So basically, as we talked in the beginning, there is several terminologies or several key elements of any monitoring and evaluation system. You have 5 elements that is key in your system, which is inputs, it's what you put into the program, activities, your work plan basically, outputs, it's a first result that you get, outcomes, it's your intended results, and impact, influence by your activities. So right now I would propose to go through each of these items to understand correctly what they mean. And I'll prepare for you some examples from the area of social work, public health, or TB, HIV epidemic. So if something will be, if you need any further clarification, please ask questions. So inputs. If you talk about inputs, it's all the resources that you have in your organization and you want to put into the program. Inputs include financial, human, and material resources. For example, wait a minute. There is some microphone in. Yeah, now it's clear. Sorry. So, for example, if you're working in TB prevention, let's say, then you will need technical personnel in your program, and technical personnel obviously is supposed to deliver services to the clients. Then you need drugs, because you need to treat people, which is IRB, anti-TB drugs, or OST, depending of your program, and some and some material resources like thermometers or computers, laptops, whatever you have in your program. Then you go to activities, basically activities of your work plan that is agreed with the organizations and your donor. Activities, as an example, maybe, for example, if you talk about the tuberculosis program, I would still ask somebody to shut down your microphone because it's very hard to hear you. Miriam. Yeah, thank you, Miriam. Sorry for saying this, but if your microphones are on, it's hard for everybody to hear my voice. So examples of activities. For example, if you have tuberculosis or HIV program, and you have nurses or social workers delivering services to the clients, then obviously one of the activities would be training of human resources that you have on counseling tests, let's say, or tuberculosis screening, or any other services that they're supposed to provide for your clients. Then if you talk in terms of activities, it will be provision of the treatment for TB patients, let's say. or children vaccination, depending of your work plan. But that will be good examples of the activities. Then if you talk about outputs, it's immediate consequence of inputs utilized and the program when the program is conducted. So what that could be? The good example will be number of TB or HIV positive people or people on substitution treatment that have been treated. Number of clients consulted by the social workers. Number of thermometers distributed, if you distribute thermometers or condoms or whatever. Number of users who received pre-test and counsel, or number of HIV tests carried out. So that will be your indicators of output level. And finally, outcomes. Outcomes, it's such kind of result that affects upon the target population that can be lead to the intent results that you have or your goal of the program. And basically, if you talk about level of outcomes, then you should understand that you have more high-level results, which is awareness of the clients or a general public, attitude towards any issue, behavior change, utilization of something, etc. Good examples in this case would be increased condom use. Let's say you work in a prevention program and you understand that youth in your country do not use condom in each sexual contact. Then outcome indicator in your case would be something like increasing condom use in each sexual contact. So you will prepare and design your activities in the way you will reach that goal. Or another example, improvement of quality of HIV/AIDS services in your country or in your region, or a reduction of risk behavior. So that's kind of examples of this. And finally, impact. If you talk about impact at the final stage, and it's actually long-term accumulative effect of your program or your project, and they're really attributed to single program or intervention. It's mostly comprehensive scope or pool of different activities that lead to your impact. What do you mean? For example, if you talk about reduction of TB incidents, that means that you cannot reduce TB incidents only by giving people drugs. Beside that, you should have good adherence program, treatment adherence program. You should have nurses in place who will distribute drugs. You should have social workers who will lead social prevention or support programs. You should have at least good number of different activities focused on your program, on your recipients and your staff to ensure that you will reach this result, reduction of TB incident. Or let's say reduction of HIV mortality. Of course, we understand that we cannot reach that only by social support. We need treatment, because without early treatment, you cannot match this indicator. Or improvement of quality of life of the patients. Here you also understand that quality of life here has combinations of different aspects, not only treatment, but also what is important, social support and other activities that you may have in your list. Then I propose for your attention kind of like log frame of objectives that will help you understand different level of the indicators. So for the monitoring indicators, you will have the following. You have your inputs here in the left corner, and here you have your resources. You have your finance, personnel, materials available on right qualities in right time. Then in terms of activities, you have your activities, and in terms of outputs, you should check if your activity is leading to the expected outputs. Then if you go up to the level of outcomes, again, you're still thinking if your outputs leading to achieve your outcomes. It's very often organizations doing the same mistake when they plan the activities. Sometimes they forget to have this logical line where you have inputs, you have activities, and you have outputs and outcomes that logically leads to your goal. If you cannot manage to have this logical frame that have these connections from inputs to outcomes, then probably in your log frame is something wrong. Then you should think and find some new indicators or some new activities that will definitely lead to leading to achievement of your outcome. For example, what can I say? If you have a program on, let's say, reducing risk of sexual behavior in young people from 18 till 25, let's say. And then by risky sexual behavior, you mean that they don't use condoms in each sexual contact. That means that to achieve your goals, to reduce this risky sexual behavior, you should plan any activities that will work with the attitude of the use. You will have, for example, a number of social workers working in schools or universities, approaching young people and showing them example how they should change this attitude. You may take social advertisement promoting the use of condoms. You need to have condoms available in your country, so they will be free of charge, or they will be distributed, or the price for them will be not very high, for example. So all these activities will lead to the goal that will reduce risky behavior of young people. But for example, if you will decide activities that sound something like, let's say, purchasing ambulance for primary health care, that will not probably lead to your activities, because purchasing of the ambulance, it's not something that will influence the risky behavior of young people. So by this kind of silly example, you should understand that not each activities lead to the outcome. You should really plan and see this logical frame. Then on level of goal, you will always have a measurement. You will have to measure, did your goal level change or not? Mostly we talk about a long-term perspective of 2, 3, 5 years to see the change of your goal or influence of your activities. Also, at the same time, to this framework, you should ask yourself a few questions, which is, what is causing delays or unexpected results? For example, if you have delays in purchasing condoms, or you have delays in workload, or hiring people on positions of social workers, then of course you should understand that you will have delays in your program also. And also you should think ahead if anything may happen that may influence your project. For example, if your legislation in the country will change dramatically, for example, you will have no right to distribute condoms to use, for example, or you will have some restrictions on some sexual education programs. So that may influence your program in this case, and you should think about that up front and think how you will mitigate such risk if they occur. Then what I want to talk with you is types of monitoring that we may have. There is different experts or books or resources. They present different types of monitoring. I try to collect some of them and group them on by the experts that they monitor. So the first and very simple monitoring is result monitoring. On some resources you may hear it or read it as impact monitoring. This kind of monitoring tracks effects and impacts of the project or activities that you carry on, with evaluation to determine if the project or activities was on track and was successful. Second level of monitoring is process monitoring, or in some sources you may find progress monitoring or activity monitoring. It's this monitoring is has linkage to directly to your work plan, and in this process, in this monitoring, you're doing an analysis of your routine data collection. You analyze whether the project tasks and activities are leading towards your results and your goals. Compliance monitoring. This type of monitoring is more connected to the audit or to the compliance with the donor regulations, let's say. Normally you have this when you have a contract with a donor and your donor has some restrictions, let's say. We're not providing services to religious organizations. So if your intention will be in this case to provide services to religious organizations, that means that you're not compliant to your donor's rules. So you should read all the contracts restriction upfront to planning your activities. Beneficiary monitoring. This kind of monitoring tracks beneficiary perception of your project or program. Mostly, you will probably have some questionnaire or some survey on the satisfaction of beneficiaries or clients. If they're happy with the programs that they received, if they're happy with the materials that they received, or anything else. The next type of monitoring is assumption or context monitoring. That is any project that is working in the field should have some assumptions or some risk mitigation strategy. That you should clearly understand that in your country, in your region, something may happen that may influence your project. Some factors may occur. So you should always determine those, be able to determine those factors and analyze them and understand how you may mitigate them. Financial monitoring, that's mostly connected to the finance of the project. Cost accounts for the cost by input and activities within different categories that you have in your project. That's more connected to the financial managers, but still it's type of monitoring that you should also be aware of. And the last one, but not the least in our list, it's organizational monitoring. Organizational monitoring normally tracks level of sustainability of the institutional development of the organization and how your results that you want to reach by your project will be sustainable after your project will finish your work. So that is also important, and it's also will analyze capacity of your organization, by the way. Now let's talk about evaluation. So evaluation is the second part of the M&E system, and evaluation is a systematic assessment of the change in target results that can be attributed to the program or to the project intervention. So let's think about how we may describe it. So basically, if you will ask yourself what is evaluation and how you may think about any questions, that will be more level of the outcomes and impact. And basically, you may ask yourself what outcomes are observed in your project. Does the program that you implemented making any difference in the situation? To what extent in the program are responsible for the observers change? So what change did you make, if any change occurs? Again, our log frame that we have. If you think about the evaluation, of course, we think about three very important terms, which is impact, effectiveness, and efficiency. If you talk about the efficiency, it's a level of three parts of our system, which is inputs, activities, and outputs. So basically, if you talk about efficiency, we should think if the resources were available in the right time and the quality were right. Were the activities implemented on time and within the budget of our program or work plan? Where is the outputs delivered in efficient manner to the right group of clients, let's say. Then if we go up to the level of outcomes or outputs, we talk about effectiveness of our project. And here you may ask yourself, were the objectives achieved? Did you come up with the result? Did the outputs lead to the intent outcomes? So if, for example, if your programs was on education of nurses, so and utilization of new knowledge by these nurses, so you should ask yourself, did the nurses apply in their daily work new knowledge or not? Did this new knowledge which they apply make any difference? Did they treat patients better than the day before? If yes, then your program was successful. If these nurses are not using the knowledge that you give them, then something goes wrong. Then you should check what's not there. Maybe they did not understand the issue. Maybe they didn't understand how to apply the knowledge. Maybe they're afraid of your clients. I mean, you should start to doing some evaluation and understand what was not there. Then the last level of this log frame, its impact, which definitely focus on the goal of your project. And here you ask yourself a questions. What change did the project bring about? Were there any unplanned or unintended changes? Maybe something changed because of your project, or you had some partners that followed your project and help you to achieve your goal. Also, there is two things that I also want to mention. First of all, again, it's sustainability of your results. So is it look like your results will still maintain after you finish your work or not? And if were the objectives that you have consistent with the beneficiaries' needs or implementers, or if they consistent with the donors' policies. So that's the question that you also should ask yourself while planning a good M&E system. Now let's see what types of evaluation we may have. First of all, it's formative evaluation, which help us to understand and ensure that program or activities is feasible, is appropriate, is accessible by the clients, and it's fully implemented. Second, it's a process or implementation evaluation. This type of evaluation is connected to the work plan and basically determines whether program activities have been implemented in an efficient manner and on time. The outcome or level of effectiveness evaluation, in some sources you may hear the term effectiveness, measure program effects on the target population or target audience by evaluating the progress that you made by your outcomes. And the last one, but not the least, it's impact evaluation, which is also a long-term evaluation, and it helps us to assess program effectiveness in achieving its ultimate goals. So if your high-level goals of decreasing level of new TB cases or decreasing level of HIV mortality was achieved, then yes, you were successful in your project and you did a very good job. If you were not successful or your indicators is not reached in a full manner, then you should understand that something goes wrong, and you should again evaluate and try to understand what you did in not a good manner, or what was wrong. Okay, so we finished the first block with difference of methodic evaluation. So maybe you have some questions regarding this. I'll be happy to answer. Yes, no, maybe. Any fears, concerns?
It was clear, I think.
One more time?
It was clear and
it was clear. Okay. So I hope these log frames that I show you will help you to understand difference between outcomes and outputs, because sometimes they often taken by mistake different times. But if you will have further questions, please ask. So now we will go to the second block of the presentation, and I will help you to understand how to choose the right indicators and why it's important. First of all, let's think what is indicators. The indicators as a variable, because it's a value change. That measures objective calculation of value, key elements of program or project. Because by having good indicators or having indicators itself, you will be able to measure your progress. And of course, indicators measure inputs level, progress level, outputs, outcomes, work capacity. Basically, the group of indicators has two major classification. It's quantitative indicators or output indicators and qualitative. So if we talk about quantitative indicators, this type of indicators should tell us whether the activities and actions were planned are actually happening. And basically it's targeting the level of output indicators. For example, what kind of indicators you may have in this case? You may have number of people attending the training. It's a very simple indicator, and I believe that all of you was gathering it after each training and seminar, and you probably understand what I'm talking about. For example, it's unemployment level, and here you may have disaggregation by age, gender, occupation. Later on, we will talk about what that. Sometimes indicator may be like number of community organizations working in your regions, let's say, or rate of HIV infection. That's also a quantitative indicator, or cost of transportation to the medical facility. That's also a quantitative indicator. Increase of households' income, infant mortality rate. That's all type of quantitative indicators. Then if you talk about qualitative indicator, that's a bit upper level of outcomes or performance indicators. And qualitative indicators are usually indicators of change, indicators of outcome. For example, you may have such indicators like greater freedom of expression in your country that you may measure by some surveys, or participation levels in sports, or women's participation in decision-making process. For example, you have a project dedicated to women's rights and promotion of women's rights and participation in decision-making process, and you investigate that in your parliament, let's say in high-level parliament of your country, you have only, let's say, 2-3 women in your parliament out of 200. And your idea is to assist women, help them to participate in the election, to educate them how to participate, and teach them how to do their best. So the level of outcome indicator here in a year or 2 years, in this, for example, in next election, will be measure number of measure this change. Did women become more active in decision-making process? How many results do they bring into the decision-making process? Do number of women change in the parliament or any other government body? Do women have playing more key role in the decision-making process? That's all maybe outcome level of your indicators. Level of satisfaction with the services. That's also a very important indicator, but especially for organizations who do service provision. And very often you may have client satisfaction survey, with the aim to analyze if clients are satisfied with the level and place of services that you deliver to them. By this indicator, you may understand, are you successful in providing them good quality services? Are the place that you choose for your services fit them? Do they need number of services or products that you give them, or they're not happy with this? So that's all measurement of level of satisfaction. Now let's think and see how the indicators usually look like. I guess most of you saw two types of indicators, and you saw the numerative indicators, for example, number of sputum smear positive TB cases, which is like real people. Or you may have a percentage indicator, which is, let's say, percentage of women of reproductive age having unmet need for family planning programs. But besides that, indicator may have a different look, and I will demonstrate you some other types of indicators that may be interesting for you also. For example, it counts, so number of providers trained and number of condoms distributed, that's easy. Calculations, percentage rates ratio, which is percentage of facilities with trained providers, if you need this kind of indicators. Percentage of female sex workers who used a condom at last sex with the client, that's also percentage. Then you may have a bit different indicators. You may have index, you may have composite measurements. For example, index on infection control prevention, where you measure how successful a program of control prevention is. Or you may have a bit complicated index called daily, which is disabled adjustment life years. The daily index is normally provided by World Health Organization to each country, and it's actually very comprehensive and useful indicator. Then thresholds, so presence or absence of something. Let's say in your country or in your region you don't have any prevention programs because any prevention programs or any programs on substitution treatment because the treatment is not available, let's say. Or you may have predetermined level of standards. So that's also a very good example of thresholds that you may have in your country. Examples. So one of the examples that I want to show you and I will try to explain why you should be very definitive in informing your indicators. For example, you have indicators that sounds like number of providers trained in prevention of mother-to-child transmission HIV services, called PMTCT. So if you talk about providers, so what kind of providers or type of providers do you mean? Do you mean clinical providers that sits directly in the clinic, or you mean any providers, or you mean private providers, or I mean, what's you talking about? So that's not clear, and because you want to have good indicators, you should have a good definition to this. Then what is trained? So by putting trained in PMTCT programs, you mean attended a 2 weeks training course in the past year, or you mean that they should be doctors that have complete education in this area, or you mean nurses that go through, year program in PMTCT or something else. So what do you mean by trained? What kind of training, what level of training, what number of days? Here you should also have a definition. Then if you talk about indicators and logframe, I also prepare you some small examples from my past work experience. And so let's look at this. So for example, if you have tuberculosis program focused on patients on ambulatory and outpatient and inpatient care. So basically, you should, as an input, you should have staff time who will take care about those patients. You have fundings, and you should have available TB diagnostic and TB drugs in your program. Then the activities that you should have, probably one of the activities will be train clinical staff. So you have clinical staff, physicians, in TB screening, which is defined training, TB screening, and testing and treatment. So the indicator here will be number of TB trainings conducted or number of people trained in this training. Then if you talk about outputs indicator, you may have providers trained in updated TB service provision. And here the indicator, a good indicator will be number of providers who have complete TB training. So you will focus only on those who finished this training. Then in outcome, you will have increase of utilization of TB service by community because your services become very good. Your staff was trained, they deliver trainings in a better way, and people become happy. So then the indicator will be percentage of outpatients, departments, patients screened for TB. So you will have one of these indicators. Then you may have a percentage of confirmed TB cases completing the DOT treatment. What is the difference? So a confirmed TB case means that the analysis is positive and this person is on a TB treatment, and completing DOT. DOT is this, directly observed treatment for tuberculosis patients. It's one of the key elements of TB strategy in the whole world, and that means that only those will be counted here who confirm as a TB patient and complete the DOT treatment. So that's a clear definition of your indicator. Then, if you talk about the impact, you will have. So your ultimate goal will be reduce TB morbidity and mortality. So the indicator here may be the percentage of deaths caused by TB, and your idea is to decrease percentage of this indicator by achieving all this and completing all of these activities that we have. Let's go to the next example. So if you want to prepare a good percentage indicator, so you should understand that you should, as in simple math, you have a numerator and you have a denominator. And of course, in your case, let's say you have yes, Miriam? So in your case, as a numerator, you have total number of people in your population with the outcome of interest. Then in denominator, you should have total number of people in your population. So in the numerator, only the focus groups that you want to take, and in denominator, all people in the population. So let's see the example. So in numerator, you have total number of women of reproductive age with the unmet need of family planning. But then in denominator, you'll have total number of women of reproductive health. So there is a difference. And by doing this simple math, you will have your percentage of women who have unmet need of family planning. Then I want to give you an example of a good disaggregation of your indicators, because to be more descriptive and to be more effective in putting good indicators, you should understand that you should have also disaggregation. And disaggregation may be by age. So let's see the example. You have people who are alive and who are on ART treatment. And you have people who is under 15 years and you have 15 plus years. So let's take those who are under 15 years. First of all, it's disaggregation by age. Secondly, you may have disaggregation by sex. So out of these children less than 15 years, you have male and you have female. Then if you talk about male, you have male under 15 years live on RT, and the denominator in this case will be all males under 15 in your cohort. If you talk about female, then you have female under 15 years alive on RT treatment again, and as denominator you have all females under 15 in your cohort. Cohort may be the country level, cohort may be the regional level, city level, I don't know, clinic or whatever you have in your mind, or where your project is focused. So if you will think about some simple indicators metrics, I have this example that I often use, and I hope it will help you to understand different blocks of this system or matrix. For example, if in output level of indicator you have percentage, or you have number of peer outreach contacts in the past 12 months, then you should think how you will collect this data and what is your data source, where you will get them. So the most easier in this case will be take program records and see the number of all peers outreach contacts. Then you should think about frequency. How often you should collect this data. For example, in this case, it's enough to collect this data, let's say, on quarterly basis. There is no need doing this collection or calculation each month, because that will be too much. And of course, you didn't want to put additional burden on your M&E specialists, and that's enough to have only on a quarterly basis. And then as a comments or decision, you may disaggregate this indicator by district or by facilities, or I don't know, by schools, whatever you work in. I mean, you should think about your interests, how you want to present your indicator. Then if you talk about outcomes indicator, we may take, let's say, percentage of commercial sex workers who use a condom at last sex with the client. Then in this case, you should have target group survey. So you should have survey among all commercial sex workers in your region or your city or whatever you are working. And you should ask them questions basically about their work, about the use of condoms in last sex, and then develop this questionnaire in asking the questions that you need for your program. It's recommended, regarding the frequency, it's recommended to collect such survey at least once per year annually, or once per 3 years. There is no need to do it more than this time, because it's very comprehensive survey, and you will have a lot of efforts. We should have a lot of efforts to put by collecting this data. So as a comment, you see that this indicator is disaggregated by age, maybe disaggregated by age. So you may have young sex workers, you may have sex workers under 50 or more than 50, or whatever you have. And you may have disaggregate them by type, let's say those who based on brothel or non-brothel based sex workers, or you may disaggregate them by sex, like female or male sex workers. So anything you want. But you should think, why are you doing this? If you have activities for sex workers by different age, and you have different approaches, and maybe yes, you should disaggregate them by age. If you have different approaches of work or activities for those who work in brothel or non-brothel base, then of course you should have these indicators. But if you don't have any activities separately designed for a male or female, then why should you have this disaggregation by sex? There is no need for such indicator, because your work is not there. This indicator will not give you any other additional information. So there is no need to put additional burden on your M&E expert or your organization. Characteristics of good indicators. Let's go through that. So basically, each indicator should be valid, of course, which mean accurate measurement of behavior, practice, or task. The indicator should be reliable. So you should have consistently measurable in the same way in by different observers. So this means that if 1 year you're collecting the indicators from like let's say New York City, it means that you always should collect this information in New York City. You cannot switch in suddenly into the Chicago or any other city or any other countries, because you cannot present indicators collected by different countries and saying that, well, we may say that indicators collected in US is valid for Georgia, let's say. No, it's different a bit. So you should always have the same consistent measurable examples. Then comparable. Your indicator should be comparable, can be measurable in different contexts or different periods. Non-directional. So that means you should understand sometimes it may be some subjective criteria, and you should understand that it should not be a part of definition. That's why your definition to the indicator should be clear, super clear. And if you add in any other explanations in your indicator, you should explain what you mean by this criteria. For example, if you want to have people trained, so by which training? Which kind of professionals, medical professionals or psychologists or social workers. If you delivering services to females, so and you may need the disaggregation by age, so young females, under 50 or before 50, so you should always have this clear definition to indicators. Prices, operational defined in clear terms. So we have been talking about that. Measurable, quantifiable using available tools and methods. Your indicators at first your indicator should be very simple. You should understand how you will which tools you will use to collect those indicators and which methods, and it should not lead to some very heavy and comprehensive surveys if it's unnecessary. Or if you have some indicators that are collected on the national level and they are available for you, then of course you should be able to get them from your ed center or a statistics center or whatever you have in your country. Then timely. You should provide a measurement at time intervals relevant and appropriate in terms of program goals and activities. For example, if your high-level goal is focusing on decreasing level of mortality or morbidity or infection rate in your country, then you should understand that these levels, kind of indicators, they are collected on annually basis. So you cannot actually present them on quarterly basis or I don't know, each month, because they will not be available in your country. Because your statistics service is collecting them each year, actually first quarter of next year to the previous year, and by this you understand that it's not available any sooner. So you should also take this time into account. Then programmatically important. Your indicator should be linked to a public health impact or to achieve an objective that are needed for impact. So you cannot put any additional indicators that not in your program that your activities will not lead to achieving the goal of your indicator. So you should always think if this indicator is relevant to you or not. Also, sometimes there is intention to create huge pool of indicators, and by this showing donor that we are very cool and we're great M&E expert, we have lots of indicators, but sometimes it's unnecessary. So there is no need to select indicator for every issue that you produce in your program, because it will be very high burden for your team, and it will not give you any additional value of this indicator or such comprehensive monitoring system. Also, there is no need to select a number of complementary indicators. So you should understand that there is a good number of indicators created by Global Fund of 5 programs. You may actually check them and take for yourself those indicators and kind of use them. But sometimes there is temptation to put everything in your M&E program, and sometimes it's too much and it's not needed. It will not give you any, as I told already, any added value or any added bonuses for you, because it will be only burden for your M&E expert or your team, and it will be hard to collect this data and analyze it all the time. Also, another classification of the indicators is by level, type, and source. What I mean, level is indicators of national, district, or program level. Impact, outcome, or output coverage quality indicators. And source, it's where you get the information to indicator, how you collect them. It may be a routine service statistic that you're doing in your organizations on a daily basis, which is, let's say, number of people trained, number of social workers to work in your facility. It may be surveillance surveys that are doing in country level. It may be behavior change surveys to measure outcome and the change of behavior of your clients or your target audience. And also it's good to talk about some limitations of the indicators that I want to present you. So I pick up a few indicators that to show you some limitations that you should also understand and take into account. For example, if you work in a project with blood safety, or you work in an HIV project and you want to somehow touch blood safety, you should understand that you cannot monitor private facilities adequately, because private facilities sometimes are not responding and not providing information to statistical services, because normally Ministry of Health Statistical Services collecting this information from the state facilities, state primary healthcare level facilities, or any other national facilities, and sometimes private one are not giving them the information. If you want to measure sexual behavior, you normally will do this through the survey. For example, condom use or number of partners that a person might have. You should also understand that it will be self-reporting bias, yeah. And sometimes when people responding to some very private questions, sometimes they may give you a little error. You know, they may sometimes be not very clear with you, or sometimes they may give you wrong answer or false answer because they want to present themselves in a better way. Let's say if it's a woman that want to present herself in a better way, sometimes she may hide the real number of her sexual clients, which is okay. And you should also understand that this may happen. That's why you should have good number of questions. And sometimes you have these hidden questions, and you may, by the good question, you may check, and you may get real result, understand when the respondent was giving you false answers. Then sero surveillance survey. Uses bias of population, but for example, only on pregnant women. This you should also take into account. If you want to have population-based HIV prevalence survey, you should understand that sometimes you may have refusal bias and sampling bias, and you should take this to account, and you should really carefully design your sampling, because if your sample will not will not be good enough, then you will have some mistake or false answers in your population-based prevalence survey, and that will influence your evaluation. I did small log frame for you to show how different indicators may work together and how you may examine your program. So let's start from the bottom and go up to the goal. So for myself, I decided to take the goal reduction of HIV transmission, and as the inputs, I decided to work with young people, and the inputs in my case was condoms and education materials, because I understood that I will design my activities in the way that I will educate young people, and I will distribute the condoms, so they will use them in each sexual contact that they will have. Activities, initiation of condoms distribution program, and adopting sexual education program for use. So let's say at schools or colleges, etc. Then if you will go to the level of indicator, in case of activities, I would have number of services delivery points, providing integrated STI services, let's say including condoms distribution, and a number of youth peer outreach workers involved in the project by the end of the quarter, let's say. Because I decided that we will have a peer outreach workers that will work in colleges or schools, and they will work with the youth and will educate them on how to use the condoms, why it's important, and why we need this method of protection. How we will collect this indicator, so means of verification, which is routine service statistic of your program or your project. And then always, what I used to say, we should think about risks that we might have in this case. For example, that may be some cutoffs of condoms procurement programs. So if you will have no condoms available, then obviously your program may be in risk, because you will have nothing to give your clients. Then let's say you should have supportive legal environment available for the condom promotion, because if the environment is, in your case, is that you're not able to do the sex education in schools, or you're prohibited to do the condoms promotion on TV media, then of course it will influence your program. Outputs indicator. So in my case, it's access to services to prevent the sexual transmission of HIV improved, and I may count number of condoms distributed, and it may be collected on routine service statistic, and again supportive legislation, condoms available, and we reach our target audience by and reach our target audience by our education programs. Outcomes. To change behavior to reduce the transmission of HIV. So that's my outcome. So the indicator here will be percentage of young people age from 15 to 24. That's the disaggregation by age. Reporting a use of condom during sexual intercourse within a non-regular sexual partner. So I decided to measure if, let's say, with the regular partner, they may use condom or not, but for me important was to see if with non-regular partners they're still using condoms. I would do a means of verification. I would do the behavioral surveillance survey with the baseline and end line, which means before I will initiate my interventions and activities, and after I will measure this difference. So when I was thinking about risks or some assumptions that I had in mind, I was thinking about poverty reduction strategies implemented in my country to raise self-esteem and decrease vulnerability of high-risk situations. So mainly we talk about women, because there is a lot of investigation that sometimes women may agree for the sex without condom because of the low self-esteem, or some if they are pushed by their partner, or etc. So sometimes it will be some cases like that. And then if you talk about the goal, which is reduction of HIV transmission, again, we have number of young people, age of 15-24, who are HIV infected. So we measure this indicator on national level. Of course, the means of verification and data is our Ministry of Health Statistics Center or AIDS Center or whatever. And we have this surveillance survey. Some risks that I might think about this, it's gender concern that limit opportunity for women, let's say, as compared to men are addressed. So women sometimes are more vulnerable than men, and we should also take into account. And that's why it's important also when you design your programs to think about these sex differences between men and gender differences between men and women, and maybe design your activities in the way the women will feel them more powerful, or more strengthened to say no to the sex without condom or something like that. When you're planning monitoring and evaluation activities, you should also understand that this kind of activities, they will support your project implementation with accurate, in what is more important, evidence-based reporting. You will contribute to the organization learning and knowledge sharing, also for other organizations and your partners. You will promote accountability and compliance of your organization, and you will demonstrate your donors how you work, that your work was carried out in compliance with their standards. For example, if ECOM has their standards, you should also, and code of ethics, you should also take into account and show that you are compliant to this. Good M&E system and good methodic framework of the project will provide opportunities for stakeholders' feedback. Especially, you should be interested in your beneficiaries or your clients, especially if you are a service-oriented organization. And the last one is promote and celebrate our work. What does this mean? It's basically connected to the evaluation or annual reports. You may, in such things, you may highlight your accomplishments and achievements. You may build moral in contributing to the resource mobilization. You may show how successful you was in your program or your project. You may show anything that was really brilliant in your work, some great achievements. That is also important to show to the stakeholders and donors. Also, small example. Again, you see our line, logical line, inputs, process, outputs, and outcomes and impact. So in input level, you have resources. In process, you have capacity building, which means like people trained, services supported, drugs procured. In outputs level, you have immediate effects of your interventions. I'm sorry. And of course, this is program monitoring, which is collected monthly and quarterly basis. Then if we talk about outcomes and impact, we have intermediate effects on behavior change. And we, of course, talk about awareness and service utilization. So here in outcome level, we talk about household facility surveys, which we collect each 2 or 5 years. An impact is a long-term goal, and we talk about this on an annual basis. And of course, there is division between monitoring and evaluation that we have in this framework. It's kind of the same questions that we used to ask before, and the only different element in this framework I want to focus your attention is audits. Audits, it's a more financial term, but still it's talk about your compliance. And you want to ensure your compliance in provision services in the right way. You want to show the donors that you're compliant to the requirement that they give you, and it's really important for your program's evaluation. If you talk about the audit, mostly it's collected and completed by the third party or external party of your program, or any local fund agent or somebody like that. That's it. So if you have any questions regarding indicators, that's time to ask them. Не слышно?
Everything clear for now.
Что? There is no questions or...
Questions, everything is clear.
Okay, should I continue?
I have a question regards getting feedback from stakeholders, like except beneficiaries, like partner NGOs or aid center and etc. Like, what is the best form to do this? Because is it good to have everybody together and present the results, or there can be another method? Because sometimes there is a situation when some organization or institution perceives you as, let's say, opponent or enemy and tries to undermine your work in front of others, and it's kind of challenge sometimes. So what do you have any advice or recommendation in this kind of situation?
Yes, I understand what you mean. So basically, you should try each communication tool that you may that you may use. It's stakeholders meeting, it's mailing list, it's digest, annual reports, etc. But in my work, I mean, in my experience, there was always at least one organization that was saying, "Well, you did not reach us," or "We have different thoughts." So I don't know, even actually what should I suggest? But I mean, doing your best, you should try all the resources and tools that you have. So stakeholders meeting, mailing list, digest, annual reports, or periodical reports, sharing your progress, or sharing your successes, saying that we did it, or something like that.
Thank you.
Yeah, because I mean, I understand what you mean. There is no good approach in this, because there will be always someone who will say, "Well, you was not able to reach me," let's say, and you will not be able to prove it, and there is no need to prove it. Okay. Any other questions? Okay, so I will continue. M&E and advocacy. Okay, if you talk about the advocacy, so advocacy, it's an activity by an individual or official, non-official group. I also want to pay attention that the advocacy made done by the official group, which is like registered NGO, or some public group, or non-official, which means some activists, some patient groups, etc., which aims to influence decision with political, economical, and social system institutions. Always, when we talk about advocacy, we talk about some decision-making policy, decision-making process. We talk about politicians. We talk about some change in the political decisions or legislation. Also, element of advocacy may be lobbying process. Lobbying process, it's a form of advocacy where we directly approach is made to the legislations or legislators' bodies. So we may have some issue, let's say, gender policy or available of substitution treatment or any other stuff, and for this we need legislation change, and that's why we use lobbying as an instrument, as a tool to make this change. If we talk about levels of advocacy, we have different levels. We have 4 levels, which is international level, high level, regional level, including regional institutions, policies, and strategies. For example, in this case, if you talk about ECOM, ECOM is working in regional level because it talks about several countries. National level, we talk about national legislation, government and policies, and we talk about some national institutions. Then if you talk about local level, including local implementers of legislation, debates or distribution of resources, we also talk about some local policies and local strategies. Local level, it's maybe level of city, of oblast, of I don't know, even some facility. If you talk about advocacy nowadays, I want to also raise your attention that now advocacy it's more about effective and efficient policy-making process. If you want to be successful in our advocacy, we should always think about evidence base that we may use. Even if you don't have enough evidence for our change, for our advocacy, then we should prepare ourselves better, because without any evidence, you cannot approach the Minister of Health saying that, well, you know, we have people suffering here without treatment, but we have no idea how many of them are here. You should collect this. You should be able to give good examples. If you talk about policy advocacy, it's always include data and approaches to advocate for senior politicians or administrators about the impact that they should have on the issue, on national or regional level. So also, I guess we have not so much time, but I want to give you some examples, and you may go over these examples of questions that you may ask to yourself to challenge your M&E framework. So, for example, if there is any current pending events, legislation, or policies that might affect your program or advocacy activities. How many messages did you send to the lawmakers? And what is more important, how many of these lawmakers respond to your questions? Yeah? Because you cannot, it's good to measure how many letters you send, but it's also very important to measure the impact, to measure how many positive responses you get. Because you may email tons of emails or official letters, like hundreds, and have 0 response. There will be no effective. That means that your program will be not effective. You should ask yourself how were the activities managed, were the work plans followed, were relations among partners successful. So that's all the issues that you should ask yourself and challenge your M&E issues. If you talk about the stakeholders, then you should ask yourself, did you make your data or your annual report available for the stakeholders? Because you may make wonderful leaflet, or you may make a wonderful report, and you may store it in your in your office, and if you will not distribute it among stakeholders, then nobody will know about your achievements. Also, very important questions is about the knowledge and attitudes, awareness. Did you make any change? What happened? Where happened? How you observe this? If you talk about M&E plan of advocacy, I propose you this logical frame. So prior to design any advocacy issues or any advocacy activities, you should analyze the situation. Situation analysis is the first step in any advocacy activities. You analyze situation, you analyze legislation, what was done before you, what was successful, what was not successful. And after that, you identify your advocacy issue. So what you want to advocate. For example, if in Ukraine we did not have an RV treatment, but we had a number of people suffering and dying without drug supplies, that means that our advocacy issue is to have drugs in place and facilities available for the people. Then you may be able to set goals and objectives to your advocacy strategy, analyze policy and power, and choose your target. Identify targets that will be your focus of your activities. You will develop messages. With what messages you will come up to your target audience, to your decision makers that you want to influence. Then you will build added strengths to your messages. You may have other partners, you may have other stakeholders, you may have somebody who will be your supporters. So you should always have a coalition to strengthen your message. Then you will be able to develop and implement your work plan. And again, after you finish it, you should analyze: did you make any change? Did you make a progress? What have you done? And while you're doing this, you should also, in the center of your advocacy activities, you should think about evidence. Without evidence, you're not able to produce good advocacy messages. You should think about monitoring and evaluation system that should be in place. You should involve your stakeholders, which is your clients, your beneficiaries, your colleagues, your supporters, members of your organizations, etc. And you should mobilize resources. And by saying mobilize resources, I'm talking about any organizations, any structures that may support you. For example, if you're fighting for available of drugs, you should think about people who suffer, their relatives, their colleagues, maybe some working associations that will lost some workforce. You may think about physicians who are not able to give a drug to a patient because they're not available. You may think about some public people who are famous, some singers, artists, etc. And you may use all of them to mobilize resources and to attract awareness to your issue. Examples of some good objectives in different level. So such objectives should include, first of all, they should contribute to the debate. So they should include simple media or development education work. Your message should raise an awareness of an issue. For example, people didn't understand that there is a problem, or they had very limited information about the issue or about the problem. So you should raise this awareness. Then, for example, you want to focus on changing minds, influencing people or change their minds on the issue that you're working with. Influence decision makers. For example, getting key personnel from the targeted institutions to agree on the need to change. Let's say if you focus in Ministry of Health, most of the top managers of Ministry of Health should understand that this change should be made and they should be on your side. Getting an issue into the agenda. For example, let's say gender policy, it's not an issue in your country, but you understand that there's a lot of women or male, female sex workers suffering from the gender inequality. So you should focus on legislation to be changed in this case. Then, or at least you should force your top officials to start thinking about this, to make them a difference. That it's not because if the problem is not occur, if the problem didn't have any face, then the legislators and government bodies, they think that this problem is not exist. So you should start talking about this problem problem or about your issue that you wanna work with. Again, policy change. This could be covered as actual changing of policy or introduction of new policy, and actually sometimes it's maybe even opposite. It's maybe it's cancellation of existing policy if this policy prohibited something. Then policy implementation. This could include changes in how a new policy is implemented. So here you work about some mechanism of policy implementation, how you will deliver it. For example, in Ukraine, we didn't have any narco policy. So in 2016, we created the strategy how to implement narco strategy in Ukraine till 2020. So basically, this policy was adopted by Ministry of Justice, by Ministry of Internal Affairs, but it was never implemented. So in our case, it's a failure because the mechanism how to implement this policy, how to involve other stakeholders was not on place and on time. So we still have this as a document on the top level, but the document didn't have any realization. Then building capacity of partners and civil society organizations. This also may be an objective of advocacy. And it's more connected to the capacity building. So basically you educate and you train small organization activists to be able to advocate on their own issues or on behalf of their community. Let's say you empower commercial sex workers to go on streets and speak about their problems, and you give them some support, or you make a voice, or you may advocate on behalf of people with Down syndromes to raise their awareness and make their problems visible for the other parts of society and the top officials. Because you understand that some of the community have very little voice or even lack of this voice. So that's how the things works. And what I want to show you a small example from Ukraine. I pick up an example from 2011-12. So on that level, we had very bad situation with HIV drugs. And we had 3,060 HIV positive Ukrainians living in Ukraine in 2011, and more 40K of them urgently needed treatment. And so what we did, we designed this visual of this campaign. It was very famous Ukrainian artist helping us design this campaign. And the idea was to gather public people, artists, opinion leaders, journalists, media, and the target of our advocacy campaign was the president of Ukraine. So idea was to write letters from HIV positive children and held the press conference in the AIDS Center for Children with the top media channels, and that was very successful, and the president got more than 2,000 postcards and letters from children, and everything was documented. So basically, it was such a high awareness and such a big political issue on that time that he made a difference. So in January 16, Minister of Health officially announced that starting from this year, all those people will get their treatment free of charge. And it was first time in Ukrainian history of HIV that state budget was doubled and allocate money for the RV treatment. So that was the beginning of free of charge RV treatment for all of the HIV positive Ukrainians, which was really tremendous change in the policy because it's never existed before. And there was a very huge success of all the civil organizations and the patients. Why we use monitor and evaluation in this case and in case of advocacy itself? First of all, to demonstrate accountability. For example, delivering on the political promises made to the citizens or any other stakeholders or to the patients. That, for example, the Minister of Health may say that we will give you free treatment. Okay, you promise us, so please give us. So that's how we demonstrate accountability of the government. To convince. Using evidence from findings to convince politicians that this issue is important. You may use evidence as a surveys, as some context analysis to show them that this problem exists and people suffering from this. To educate. So any reportings, any findings, any conferences have their first aim to educate other stakeholders, patients, politicians, any other people that is in your target. Explore and investigate what works, what doesn't work, and how we may mitigate these risks. Document by recording and creating institutional memory of organization. Involve other stakeholders and supporters, public people, actors, singers, etc. Gain support, again, from varieties of stakeholders, and promote understanding. So basically, you promote achievements and results of your projects, programs to make politicians understand that this was important, that was done, and still we have something to advocate for. Okay. The third part is done. So if you have any questions, please, there is a time to have them. Maxim?
Marichka, it is not a question, rather a comment from my side. The majority of our organization, of our partners, is a very small organization with small resources. And they deal with indicators on the activities level.
Mm-hmm.
So I think it is there is some difficulties to think about goal level indicators. Maybe you can make to us some additional good examples of this kind of this activity. Not activity, goal level for a small organization.
Yes, for example,
in advocacy, yeah.
I think I may remember one case that I had last year. I used to manage one project in a very small city in Ukraine, which has 50,000 people population, middle level of HIV epidemic, and middle level of burden. And basically, they was focused on a central level clinic, and the idea was for this clinic to provide comprehensive services on tuberculosis, HIV, HIV treatment, and substitution treatment. So our idea was to advocate in a rayon level decision makers to allow the opening and substitution treatment cabinet. And basically, what was done? First of all, we did very good situation analysis. We analyzed how many injection doc users was in this district. That this district, what is important, and there was a lot of people living there. There was great demand of substitution treatment. That this clinic already have TB, HIV, so it's logical to have methadone treatment also. And we give them huge overview and some examples from different regions of Ukraine and even other countries, how successful comprehensive projects are, because in one place client may received HIV, TB, and methadone. Plus, we did a client satisfactory survey, and this survey show and demonstrate us that clients will be happy to have this methadone treatment on place where they live. Because 2 years ago, the treatment was available in Cherkasy, which is like oblast level city.
Mhm.
And it was like 1 or 2 hours travel one way to the client, for the clients, which is inconvenient, and which is sometimes client was not able to go to the clinic and reach this and take methadone or other treatments. And we advocate through regional coordination councils on TB and HIV that we have in Ukraine. We advocate through physicians, so we was able to make a very great relationship with the doctor of AIDS center and doctor with TB dispensary and other doctors to be able to open this site. Plus, we convinced deputy mayor that which benefits he would have, that he would have safety for his citizens, he would have good medical programs, he will be very successful as a politician because he will be modern and he will follow modern rules or modern trends, modern trends in treating people, and he will be very tolerant. So there was all the kind of manipulative techniques that we use in approaching this deputy mayor to kind of be our supporter. And yes, we were successful in this. So this one case, and it was very, very low level goal, because it was really small rayon, not very rich, not very important in terms of in comparison to other rayons in Ukraine. So something like that.
Super. Any other question?
Anybody else, guys? No? I guess not.
Well, sometimes when people are quiet, I'm afraid that they're scared out of the presentation, or maybe I did not answer something correctly, or you have more issues to be discussed. I don't know.
No.
Okay.
Sorry.
We have something in the chat.
It was very interesting.
I'm saying it's very interesting.
But no question.
Yeah.
I think.
Okay.
That's just a feedback.
Okay. So.
Anybody else on this stage? No.
Okay. So let's look on some templates that I might propose to you. It's very, so one of the templates I want to share with you, it's not a scary one. It's I was always thinking that I need to have some tips or some checklist for different types of events that I may run for my organization, let's say. So I prepared for you this checklist that looks like a table, and you have large media events, you have meetings, you have education events, and you have business trips. So basically, if you will want to be accountable in front of any donors, you should understand that you have some primary documents to be in support of your event when you conducted it. So basically, if you want to have press conference, you should understand that you need a concept note, a scenario for a press conference. You should have official invitation for your government officials and list of participants, and of course, to finish and to summarize your press conference and report on it, you should have a press release that you will have, and you will send to as other media. If you have training, for example, training is a leader in supported documents here. So if you have training, you should have agenda for your trainees. You should have official invitation and official approval of the event if you talk about some public officials or chief doctors, let's say. You have a list of participants. You should have training report to your donor. You should have information materials like presentations or some homework assignment or etc. And you should have knowledge tests or questionnaires to measure pre and post training knowledge that you was able to provide to your trainees. So if you have a study tour, let's say to any other region or rayon or a country, again, you should have agenda, you should have official invitations, because if you want to show by study tour to any government officials that in, let's say in Georgia, there is medical marijuana available like for the people, then in Ukraine is not. So we may have the study tour, and on Georgia's example, we may show how good it is or what benefit it gives to the clients. Let's say it's what's coming to my mind. Then, of course, you should have lots of participants, reports, and information materials, and questionnaire if it's applicable to measure what trainees was getting. Sorry. Then I give you some template for agenda. It's very simple. Maybe it will be easy for you to use, and if you like it, please use it. Sona will put everything in Excel or MS Word format, and you may upload it easily. Again, participants list. So I put it for your. It's bilingual, and maybe it's easy for you to use. If you like only English, then delete the Russian version. Again, pre and post training questionnaire. For the moment, it's available in Russian, but I will translate it into English, so you will have the one in English. It's some small examples of questions that you may ask to your audience, like you may put in the right order the questions, you may pick up the right answer from the list that you give them, you may do everything what you want. But the most important here is to have the same questionnaire for the pre-test and for the post-test. So you're not allowed to change your questions in pre and post questionnaire. And again, it's very useful.
To compare.
Yes, to compare the same kind of questions. And of course, it's very important at the end of your survey of the training to ask people about how they're happy with the training that you provide them. So you may ask, did they like the place the venue where you held the training? Did they like the food or materials that you prepare for them? Did the training match their expectations or not? And again, you may ask them if it's too long, too short, or or they believe it's unnecessary for them, or it's very valid for them. Also, I was asked to prepare and develop some monitoring form for you. So I developed a small one, which is number of days of monitoring, information of organization, which you want to monitor, goal of your visit. Then here you put any activities and status of these activities, like completed, delay, or failed, and some comment why it was happened. Again, it's important in monitoring visit to say about some achievements, about some problems, and how you want to fix them, and some recommendations as results of your monitoring visit. Because the most important in monitoring visits is not to punish someone because they didn't do something or they did not achieve something on time, but the main goal of the monitoring visit is to recommend and educate. So basically, it's a tool of on-job education or training for your grantees or for your colleagues to show them by good example how their work might be increased, or how they may be more successful in their job on their functions. That's it. So if you have any questions on this. Sona, да, Максим?
Anyone? If you have questions, it's just the right time to ask.
I just have a comment. So I think, so first of all, thank you for the webinar, because I really had this knowledge on the practical level. When I usually do reporting to different donors, they have a bunch of questions about outputs and outcomes, and I had to write this, but my knowledge was really chaotic, and now it's kind of, everything came together and it's more logical. And yeah, thank you for that. The second comment, so I think monitoring and evaluation, you really need to have resource for that, the person who has time and knowledge to do that, because it's resourceful to do this. And for me as a project manager, it takes it's I think impossible to do project planning and implementation. We have so many activities and so many work to do, and then to do monitoring and evaluation periodically, like in a really thoroughly. So it's quite challenging. And I think that we really need to have one person, maybe who is, I don't know, programs manager, who will periodically overlook how the projects are going, and kind of because we have, so usually executive director does that in our organization, but this person also has many other functions, because we don't have, for example, programs manager or fundraiser as a separate person. So everything is done by executive director. Yeah. So I think it's very much connected to resources, human resources, and we really lack that. So, yeah.
Yes, you're very right, because the workload of an M&E person is really high, because you should monitor all the trainings, all the information. It should be done on a regular basis. You cannot do monitoring like once per month for one day and just forget about it. Then you will not have this frequency, you know. And you are right about human resources. Ideally, it should be at least one specialist in the organization who will do the documentation collection and all other stuff on monitoring and evaluation.
Coordination of data collection.
Yes, and data collection, of course.
One thing that I can think of right now is when you are planning your future projects, you should keep in mind that the project should be monitored, you know, and then if you have several projects, you can put like a shared time for a designated person. I mean, monitoring is part of each single project. It's crucial, you know, for successful project implementation.
Yeah.
So you can have like 3 projects and then pay a person from 3 different projects. But initially, when you are planning and applying for a project, you have to budget for that person. Yeah. And our point today is that you understand that monitoring is an essential part of the project implementation and organizational functioning.
Yeah, I totally agree, and of course we do that at some point, because it's we have to do it in every project. But yeah, what I meant is if it will be good if someone does it more systematically and really high quality, so everything is evaluated, and you know, impacts and outcomes and everything. So, and we usually are dependent on what each donor requests from you, and it's not like organizational and programmatic approach. So yeah, definitely we will try to budget one person for this in the future. Thank you.
You're welcome. Thank you.
Any other questions?
Anybody else?
I guess yes, no.
No?
So what I may summarize that this presentation will be available and sent to you via Sona's email, and together with all the templates, and the two of them I will still translate to English, so you will be you may use them as you want.
Yes, definitely. Just to emphasize it from our side also, we will definitely create an online resource for you where you will have both the webinar recorded, the webinar that you can get back to, and you will have all the templates and the forms of the essential M&E documents that were presented today to you, and you can make use of those and adjust those as you need, as you find appropriate within your organizations. Okay, Thomas says thank you.
Thank you, everyone. So I guess it's time to say goodbye. Thank you for that attention. And if you have any further questions or information, email Sona and maybe I'll assist you in some way.
Thank you, Marichka. It was very interesting. Thanks for doing this for us. And thank you all the participants that are now sending thank you messages. Thank you for your time and participation. And we really hope that you will make use of this resource and build on your M&E capacity.
And we are waiting for your questions, next questions by email.